and Dr. Loving today. We just took a testimonial from a patient who was getting their medical card, and since this is the first time we've met, you asked me about my story.
Yeah.
Okay. It started with my first introduction to anything mind-altering, which was Vicaprofen. I don't know if you guys remember those, but this is the year 2000. And my dad's a doctor, he's a DO, and in one of his exam rooms, there was a great big cardboard box on the wall of these Vicaprofen 2-packs, and they were just like handing them out like candy. You know, drug reps would bring boxes in, and I had just tore my ACL, and I was dealing with that pain, and I was at my dad's office, and I grabbed a handful of these Vicaprofen, stuffed in my coat pocket. I had never drank a beer. I was 21 years old, never smoked a joint, smoked a cigarette. Just got home from my LDS mission a few months earlier, and I remember the day, I remember the place I was at. I was driving from Utah State down to a friend's house in Brigham City, and I was halfway there. I was passing Manaway Lake, and I thought, it's time for me to take my pain pills. But then I also thought, well, my leg doesn't hurt. I don't need them. And then I remember the doctor saying, well, you need to stay on top of it. I'm like, okay, I'm gonna go hang out with friends. I don't wanna be in pain. I'll just take these 2 Vicaprofen. And it was about 15, 20 minutes later, coming down the canyon, I felt this sensation I had never felt before. It almost felt like a warm blanket. It was more than just physical comfort. It was an emotional comfort, and it was something familiar, but I'd never really experienced it before. It was the first time I'd ever gotten high or felt euphoria from anything. And so I became a hardcore opiate addict. I got prescriptions. I would take OxyContin 80s all the way through the 2000s, right? From this time in 2001 when I really got into pain pills all the way up through 2010. For 10 straight years, I was on either 1 or 2 green OxyContin 80s every day. And if the times when I ran out of money or couldn't get them, I was sick, and I would go to other drugs, and it was horrible. But April of 2010, things started to shift, because at that time they had this thing called Spice that came out, and I was not in the drug scene. I was just going to doctors and pharmacies and getting my medication. But I read this article about this JWH compound, this Spice, and how it's like marijuana, but it's legal and it's at the gas station. And so I snuck and tried that, and I was able to start taking less of my OxyContin, and I was not it didn't make me as sick when I would go through withdrawals. And then I met a Suboxone doctor who got me off the OxyContin altogether and on a Suboxone strip, and I was on a very small dose, just 1 milligram a day. I was cutting a 2 milligram strip in half, and I would wake up and take that in the morning, and then I would smoke this Spice that would affect my CB1 and CB2 just like marijuana does. And I would enter kind of a present space every morning. And I would pray, and I would meditate, and I would plan out my day, and I would not have cravings. I wouldn't abuse Ambien or Xanax. I wouldn't go seek pain pills. So for 3 years, I was on 1 milligram of Suboxone a day and Spice until Spice became illegal, and I couldn't get it anymore. And there was a hole. There was some part of my medication regimen that was not whole and was not working, because I started having cravings. Even on the Suboxone, my Suboxone doctor would increase, but then I would sneak and I'd go get alcohol, and I'd have a relapse, and it started getting worse, and I got into heroin and amphetamines. And now that medical cannabis is legal in Utah, I'm using it in my own recovery residence, Men's Tribal House Sober Living. I met Dr. Loving, who has a similar mission as me, and I know that there is a place in substance use disorder. I know there's a place for medical cannabis treatment. And I'm not saying that it's right for everybody or that it's a fix-all, but I know for me, for years, I thought that I was just crazy. Like, how can weed make me better? Well, I don't know how, but it is. And now there's studies showing that it delays the stimulation response in the brain. There's studies that show it's helping restore pornography addicts to normal neural pathway behavior. So it's working in a myriad of ways for a segment of the population. So I'm just an advocate for Utahns getting their medication, doing it legally, lawfully, and managing addiction with this all-natural supplement, medical cannabis.
That's awesome. Thank you.
Thank you. I never would have done that if you didn't